doctor.
Gerry, Willem, thank you for joining us. What was your initial reaction to getting that diagnosis, Gerry? I mean, wow.
Shock and horror. And then the logical mind begins to work, and I say to myself, hold on, your first priority was to get pregnant.
That's right.
So let's just go back to what it is that the purpose of going into this all was, and then you can begin to make calls to begin to find out ignorantly whether you'd inherited this, or what did you do in your short life to deserve to have TB? Because at the time I was convinced that it was a death sentence.
Sure.
So, you know, firstly, okay, so I want to get pregnant, so I have to find a TB clinic. All right, and when I find the TB clinic, they'll tell me if I'm going to die from this or not. Okay, because...
And this is an educated South African...
Well, yes, in the middle of Big Brother.
Yeah.
So, in the middle of Big Brother, and I have something that is hugely stigmatized in South Africa, and something that all I know is they used to put you away in asylums. There was a time, and I remember Shakespeare in Love, and someone going, oh, and coughing. I don't even look like that. I'm not pale, I'm not hungry, I'm not, you know, there's nothing wrong with me. So it took me a while. Believe it or not, I found the clinic. But that was after 2 or 3 weeks of calling around trying to find treatment.
Wow.
Okay? From one Santa clinic to another. Oh, no, you have to find a clinic close to your house. Well, where do you live? I live in Sandton, Johannesburg. Oh, we don't have a clinic in Sandton, Johannesburg. Well, oh, apparently Santonites don't suffer from TB.
Yeah,
so where do I find treatment? And eventually I found it about 4 minutes, Michael, from my home in Randburg. Hidden away behind a library. That's where I found a TB clinic, and it just ate at my little compassionate heart that we were hiding our TB sufferers behind high walls and libraries and trees.
Because that's what we do, because of the stigma with TB, you know.
No signage.
Gerry, it's been 11 years. I've wanted to ask you this literally since then. Why did you speak out? Because no one needed to know about the diagnosis.
Except that someone was going to pop into the TB clinic and recognize me. And then someone else would have shared this with the world. That was the selfish reason.
Yeah, but there's a bigger reason, because I know you.
The bigger reason was that these people had no face and they had no voice. And there was no ventilation in the clinic, and there was no water on tap for when they got their dry cough. And I could not allow this to happen. I could go home and have a thorough breakfast, have a supportive husband as my DOTS partner who helped me through my therapy, and what did the rest of my fellow sufferers have? And when I went to conferences on TB, they spoke to us like we were numbers. We weren't patients, we weren't people. And so I felt I needed to give a face to the sufferers of TB, and
you've
I've been doing it
that
ever since. And I still feel this with great compassion that we can do so much more.
Yeah. And we're going to talk about that. Willem, do you think we have an epidemic in this country?
TB is a huge problem worldwide. 1.7 million people die every year from TB worldwide. But South Africa actually has the second highest rate of TB in the world. And why is that? I think a lot of TB goes along with HIV, so you cannot separate TB and HIV. So more than 50% of our TB patients have HIV infection, but it's also because a lot of TB goes with socioeconomic compromise. So if you come from poorer environments, if you don't have adequate nutrition, if you have stress in your life.
You're living in close quarters.
Exactly. Yeah. That's when you get TB. And we've got these issues in our country which actually predispose us to having a huge epidemic at the moment.
Just some of the basics. TB is acquired through sneezing, spitting, coughing. What are the symptoms? What are we looking out for?
Sure. So coughing is number one. Okay, if you get TB, you will cough. And it's usually a cough that goes on for longer than 2 weeks. But there may be other symptoms too, like night sweats or losing weight. Sometimes you will cough up a little bit of blood. lots of symptoms that just feeling tired, feeling malaise all the time. That's a classic way. How did yours present?
And well, mine presented only in my womb, so it was really through a biopsy that mine was found. But you know those night sweats
exactly.
and that loss of weight that it goes unexplained, for example. And you know, from a patient.
And you were worried about loss of weight?
I didn't have loss of weight. But you know, the little things that niggle you. You've had a slight cold. You went and got your antibiotic. You took the antibiotic as regulated by your physician. You're still coughing. Exactly. It's just as dry, and now it's hurting more. It's for the patient to assert themselves, to go back and say, I'm still coughing. I did take my antibiotic. Can you check for TB?
Yes.
Shouldn't be the last thing we check for, and that's another problem. Yes. Shouldn't be a last thing we check for. It should be as regular as, okay, so we've cancelled out a cold, flu, bronchitis, TB.
Yeah, needs to be in the middle of the radar.
I believe so.
So now TB is curable. We know that.
Yes.
What did it take for you to get fully cured, Gerry?
9 months of 6 to 9 pills a day.
Wow. And you wouldn't believe it, they call this short course therapy.
I was on a short course. 9 months of 6 pills a day, and I could not have done it without someone helping to observe my treatment, Michael. Just imagine. You go 2 days on your antibiotic, you're no longer sniffly, you're thinking, do I really need to take this for the 3rd day? And someone has to say to you, absolutely you do. So when you get to the 4th month, and you've regained your weight and the energy in your body, and you're able to work again, and you're not coughing, no more hurting in the lungs, someone needs to be there for you. And we call that a DOTS party, someone who directly observes your treatment. Someone who says to you, come on, finish this, because this is 100% curable, or else you will become more ill.
That's right.
Very important.
What happens when non-compliance takes place?
Yeah, so I think this is a very important question, because you do feel better and you want to stop the therapy. You don't want to take drugs all the time. But that is exactly when the few bugs that are still inside your lung or inside your body that are not adequately cured, and those bugs can grow out again later. And the problem is that if they do grow out later, often those bugs are then resistant to the antibiotics that we used in the first time. And that is a big problem, because at that stage, these antibiotics that you then have to use are extremely expensive. It takes much longer to cure that. And often, unfortunately, it also is associated with huge death rates, these multi-drug resistant TBs that can then develop if you don't take your medication appropriately.
Okay, so let me ask this question. I've got 2 stalwarts of tuberculosis. I've got a great ambassador. I've got a professor of infectious diseases. How do we beat this in our country?
I think I will agree with Gerry. The first thing that we have to do is we have to work together. We need advocacy for TB. There's much more advocacy, for example, for HIV infection than for TB. And that is a pet hate of mine. Okay, the voice needs to be out there so that we can get more funding for research, because the true advances in TB is ultimately going to come through us understanding the disease better, getting better drugs, getting better vaccines to prevent the disease. That is where the advances are going to come in the long term. In the short term, we need everyone to work together. And that's how we're ultimately going to beat this disease.
Correct. Sure.
And when Willem says that, he doesn't mean only the TB community working together. He means a society to work together. Because this is airborne, TB is airborne, the fact is that if you're a perfectly fine individual standing in a queue in a store, the person next to you coughing might have TB. They don't have to be HIV positive, which means I am my brother's keeper. And because we are links in a chain, I think the more awareness we can spread, the more people who understand that this is not about one person or one community or about the poor or about the person with the dark skin. This is actually about each one of us in South Africa taking responsibility and spreading the message and working together to get to the next level. The quicker we can beat this.
Gerry, Willem, thank you so very much. When it comes to tuberculosis, I breathe out, you breathe in. That means we're one in the struggle and this fight against TB.